Hello and welcome to Level 3 Health and Social Care, Unit 6, the Stroke or CBA unit. And we are in week 4 and we're looking at the last part, the second part of this week's work. Okay, we're having a look at some research on stroke units, or we're thinking about some research on stroke units, and then I'm going to talk you through the assignment. Okay, so the objectives we're looking at, the last objective really that we're going to cover is 3.3, evaluate the effectiveness of care in a specialised stroke unit on outcomes. Okay, so in other words, it's asking you, is the care better? Is it more effective to have someone go to a specialist stroke unit than an ordinary nursing unit in a hospital? Okay, so think about that. So this time, I'm not really going to tell you too much. I've added a couple of articles in extra reading, and I want you to have a look at them that should help answer the question, really. Do specialist stroke units improve patient outcomes? So what you need to do, generally research tells us, and lots of research tells us that yes, they do. People's outcomes are much better if they go into a specialist stroke unit than if they're in just an ordinary hospital ward. So all you need to do is to find some evidence that actually supports that statement. So I've added some documents, and you can find evidence in those two documents if you go into extra reading. And another piece I put is there's something that are being developed in the UK called hyper acute stroke units, and they are sort of specialist stroke unit +1. So they've got really specialised teams. They're sort of like the cutting edge of a stroke unit, really, where people go straight to them and hardly spend any time in the ordinary hospital. They literally sort of go straight into them. So I've given you an article on that as well, so you can have a look there and see what evidence there is for them to be even better. But as you can see, both articles will be saying yes, that be it hyperacute unit or an ordinary stroke unit, it's definitely better for people to be there. And there's, as I said, those statistics there. So please have a look at those articles, make yourself some notes, because it is one of the questions in task 3 of your assignment. So make yourself some notes and bring in, don't just use my evidence, because there is evidence around. I'm going to ask you to sort of Google some stuff on your own and find some other evidence to support it. You will find it. There's stuff all over the world, really. So you don't even have to just focus on the UK. You can certainly find it. You can probably find it in your home country as well. So I don't mind what evidence you bring in from where, be it from the US, from Malaysia, for this one, really, because it is a world issue. But just find me that evidence, okay? So I'm going to let you do that on your own. I've already given you the answer. The answer is yes. So you just need to find the evidence, but you will, okay? So let's move on to talk through the assignment in general. Okay, so do pay sort of close attention, because I will be giving you some guides on what you need to think about. So let's have a look at task 1. You've got 400 words. Remember, you need to work within your 400. Please don't go over it. If you go over it by more than 10%, then I have to take some marks off. Okay, so don't forget that. Okay, the first one is 1.1. Explain the different types of CVA. If you think right back to week 1, where we actually broke down the different types of CVA or stroke, okay? If you remember, there was 3 different types: TIA, ischemic, hemorrhagic. So what you need to do is to Give me a few lines about each one of them. Okay, so I'm looking for 3 different types. Okay, if you do less than 3, you probably won't get as big a mark as if you did all 3. Okay, so try to remember that. It's in the slides, so it's not that hard. Okay, and then the next part of it is discuss the signs and symptoms of left-sided and right-sided CVA. A way to do this succinctly using less words is don't give me all the stuff where they're both similar. Just give me a few summary sentences about the general signs and symptoms, but then give me some specifics for left-sided CVA and right-sided CVA. So things that are different. Otherwise, I'll just be reading the same stuff, and that's not very good. So I want you to show me that you know how left and right-sided CVA differs. Okay. 1.3, analyze the reasons for different presentations of signs and symptoms with regards to physiology of the brain. This is where you link the signs and symptoms to the different parts of the brain. Okay, remember we did a little thing, we did a brain exercise. We talked about the cerebellum, the cerebrum, the brainstem, frontal lobes. We talked about the different parts and the different areas that they controlled. So I want you to link. So you can't give me every signs and symptoms because you don't have enough word power. Just pick me out a few signs and symptoms and explain to me why they came around, like what part of the brain, is it motor? Is it from is it the cerebellum controls this, and this? So you might see motor issues, you might see balance issues, okay? So just give me that. You want it to do in a nice snappy summary. You've only got 400 words, okay? Remember, you can only go over by 10%, so that's 40 words on that task. Okay. Task 2 is much shorter, so keep that in mind. It's only 200 words, so it means that you can't write so much, okay? Which is difficult sometimes because there can be a lot to say. So discuss the risk factors. 2.1, discuss the risk factors associated with the CVA and the preventative health measures. So you need a nice, neat summary. Risk factors, a lot of it is to do with lifestyle. So you can do a little bit of a summary on the lifestyle, eating well, eating vegetables, not drinking too much, not smoking too much, those sorts of things. And think if there are any other risk factors. Are there any genetic factors? Are there any factors, for certain races who might be at a higher risk? Just go back to some of the things that we've discussed. There's plenty of information there for you. Okay. If someone already got high blood pressure, is that a risk factor? If they've got diabetes, is that a risk factor? Okay. So you need to summarize it. You've only got 200 words. 2.2 wants you to compare and contrast the available investigations. There's quite a few investigations, but there's very few that you can compare and contrast because they're all different. So you've got blood tests, you've got CAT scans. They're actually quite different, quite hard to contrast. So what I would suggest is you pick something that you can do a contrast. So you might do a couple of sentences on possible available investigations, like blood tests, like swallowing tests, like taking histories, general observations like the fast observation, okay? And then maybe compare something like an intervention like CAT scan and MRI. I've given you an article to read in extra reading, which actually tells you about the sort of value. So you need to do a compare and contrast. So you need to talk about two things and then maybe come out with an outcome about what might be the most valuable. So I would suggest you look at CAT scan and MRI because you have that information there. Okay, so remember that.